Knock, knock. Hi, my name is Shannon Plaster. I'm the family nurse practitioner student that's going to be doing your head-to-toe examination today. Is that okay with you?
Yes.
And is it okay if I video record it?
Sure.
Perfect. So I'm going to wash my hands and put gloves on before I touch the patient. So first I'm just going to start by asking you a few questions. Can you tell me what your name is?
Dustin Plaster.
And where are we?
The doctor's office.
Perfect. What year is it?
2019.
Okay, so the patient is alert and oriented times 3. Are you in any pain today?
No.
Okay, sounds great. So first I'm going to start by looking at the patient's head and face. It is symmetrical and rounded. All the patient's features are symmetrical bilaterally and the color is appropriate for ethnicity. Next I'm going to move on and look at your eyes. I'm just going to pull the bottom of your eyes down. So the conjunctiva is translucent. There's no erythema noted. Looking at the patient's eyes, the sclera is white. Next, I'm going to shine a light in your eyes. I just want you to look at my nose while I do that. Okay, so the patient's pupils are A3 and perla, and the cornea is clear. Next, I'm going to move on and look at the patient's nose. The nose is symmetrical bilaterally, and there's no drainage noted. Looking at both of the patient's ears, they are also symmetrical bilaterally. There is no redness, drainage. I'm going to feel them really quick. Are they tender?
No.
No tenderness noted. And there are no foreign objects sticking out of them. Next, I'm going to move on to the mouth. The patient's lips are pink and moist. Next, I'm just going to pull down your lip and look at the side of your mouth as well. Okay, perfect. So the patient's gums and buccal mucosas are both pink, dry, and intact. Can I get you to smile for me? Okay, so the patient's teeth are white. They are all present. And so next, I'm going to get you to stick out your tongue for me. All right, so cranial nerve 12 is intact. You can just put it back in your mouth. Thank you. The hypoglossal nerve. Next, I am going to get you to stick out your tongue and say ah for me. Okay, so patient's cranial, do that one more time for me. I was trying to bright light back there. Okay, so patient's cranial nerves 9 and 10, glossopharyngeal and vagus are both intact as well. From that, I also saw that the patient's tonsils are present, but there's no drainage or redness noted. The patient's hard and soft palates were both pink and intact. And the patient's tongue was also pink and intact. Next, moving on to the patient's neck. Inspecting the neck, it is equal bilaterally. There are no pulses or pulsations or lumps noted. I'm going to feel both of your carotid pulses. Okay. So the patient's carotid pulses are 2+ bilaterally, and I'm also noticing that there are no lumps present. Moving on to the patient's chest. The breathing is non-labored and even, regular rate and depth. The skin, I'm just going to feel your skin really quick. So the patient's skin is warm, dry, and intact. Skin turgor is appropriate. Next, I'm going to listen to your lung sounds. Each time I move my stethoscope, I'm just going to get you to take a deep breath for me. Is that okay?
Yes.
Okay, so I'm going to go around to the back and do the same thing.
Okay.
Okay, deep breath. All right, one more deep breath and we're done. All right, so the patient's lung sounds were clear and equal bilaterally throughout all the lung fields, and the skin on the patient's back was also clean, dry, intact, and the color was appropriate for ethnicity. Moving on next, I'm going to start by looking at your heart. First, I'm going to feel your apical impulse, which is at the 5th intercostal space mid-clavicular line. Has a good strength to it. So next, I am going to listen to your heart in a few different spots. Once I get done with my one side of the stethoscope, I'm going to flip it to the other, so it might be just a minute. All right, so The aortic valve is second intercostal space, mid-sternal line on the right. The pulmonic valve is second intercostal space, mid-sternal line on the left side. Second pulmonic space is third intercostal space, left, mid-sternal line. The tricuspid valve is fourth intercostal space, left mid-sternal line, and then the mitral valve is fifth intercostal space, left mid-clavicular line. All right, flipping it over to the other side. Okay, so then I'm just going to take this and I'm going to listen to your heart rate. All right, so the S1 and S2 were present throughout. There was no S3, S4 noted, and there were no murmurs heard throughout. The patient's apical pulse was 75 beats per minute, and it was irregular. Next, we are going to move on to your abdomen, so I'm going to help you lay backwards. Okay, so first by looking at the patient's abdomen, the skin is clean, dry, and intact. It is symmetrical bilaterally, and so next I am going to take a listen to your abdomen. Okay, so bowel sounds are active and audible in all four quadrants. Next I'm going to palpate your stomach. So I'm going to start with a lighter touch and then it'll get deeper. You just let me know if it hurts anywhere. Any pain?
No.
Okay, so the patient's abdomen is non-tender and there was no lumps or masses noted in the abdominal exam. All right, so I'm going to help you sit back up. All right, perfect. So now looking at the patient's extremities, the arms are equal bilaterally, the joints are also equal bilaterally, the patient's skin is warm, dry, and intact. I'm just going to feel your pulses. So the radial pulses are at 2+ bilaterally, and then your cap refill is less than 3 seconds. Moving on to the patient's lower extremities. Patient's lower extremities are equal bilaterally as well. The joints are also equal bilaterally. The patient has no pretibial edema. The skin is clean, dry, and intact, and there are no scars noted throughout. I'm just going to feel your pulses. So the dorsalis pedis and the posterior tibial pulses are both at 2+ and present, and the patient's cap refill is less than 2 seconds. All right, so I'm going to let you get dressed, and I'll be back in a minute.
Thank you.
You're welcome.